Just as sunflowers chase the sun, inductees into the South Dakota Hall of Fame chase their dreams day after day, year after year. The 700-plus inductees in the Hall of Fame come from all backgrounds and corners of our state. What their stories have in common is their unwavering courage and belief in their dreams. These dream chasers are an inspiration for us all to strive for excellence and believe in our own potential to chase dreams well into the future.
Lyle Schroeder devoted over 35 years of service to Sioux Valley Hospital in Sioux Falls, South Dakota. Schroeder started his career with Sioux Valley Hospital working in the housekeeping and maintenance departments and rose all the way up to president and CEO. Under Schroeder's leadership, Sioux Valley Hospital has received numerous honors, including being named one of the top 100 hospitals in the country and to the top 100 cancer treatments and cardiac centers. Throughout Schroeder's career, he has given credit to the successes of Sioux Valley Hospital to his board of directors, the medical staff, and his fellow employees.
Hello, I'm Miles Beacom with the South Dakota Hall of Fame. Today, we have a 1994 South Dakota Hall of Fame inductee to talk to, Lyle Schroeder. Welcome, Lyle Schroeder, and
thank you, Miles.
Very much for joining us this morning. And
thank you. And then I enrolled at Augustana College in 1952. And while I was at Augustana, I started working at Sioux Valley Hospital as a part-time worker. My first job there was washing walls and surgery in the afternoon after the surgeons had completed their surgery. And then I had another job in the laundry department. I worked in the maintenance department. I worked in several departments while I was going to Augustana College.
So when you were at Augustana, did you ever think you'd retire from Sioux Valley?
No, I did not. It was a part-time job. I needed the money to get through college, and so I never visualized the fact that I'd even be in healthcare administration. That at that time, my objective was to get through college and pay my way with my expenses that I was getting the money from Sioux Valley Hospital.
What was your major in college?
Business administration.
Okay.
And then I received a master's in healthcare administration from the University of Minnesota. And then I had an offer from Sioux Valley Hospital to come back as assistant administrator, and that happened in 1960.
What did you think when you were made that offer to have an opportunity to come back to Sioux Falls, where you went to college, and be the system administrator?
Well, I knew there'd be some positive things about it because I knew a lot of the people that were there, but there are a lot of people that were there knew me as well, and I didn't know how they would react to the guy that used to haul the garbage out and wash the walls and work in the laundry, being the assistant administrator. So it was kind of a learning process for me as well as for the employees.
Did you have any challenges with that?
Oh yes, I did. As I said, that a lot of people remembered working with me as I was doing the work of the laundry and stuff like that, and to see me at work in a suit and a tie, and now being in administration was something new for me and new for them as well.
How'd you overcome that challenge with some of the people? Is it just working together with them? Or?
Just work together with them and being honest with them and being forthright and being fair with them is the main thing. And of course I could kind of think about how the employees were reacting to things because I previously had been an employee and had to react to decisions of management.
Lyle, I just look at what you've built at Sioux Valley and what Sanford then has taken on when they took the baton over. But I look at everything that they do in the community, not only healthcare-wise, but community service-wise, and how strong our community is because of what you started. And I just think it's amazing. And when you look back, what are your thoughts on the impact that Sioux Valley, Sanford has on this community, because when you took over, Sioux Falls was probably in population, probably about 50,000.
50,000, exactly it, yeah. Well, back then that was prior to Medicare, prior to Medicaid. In fairness to the hospitals did not have a lot of money. I mean, it was difficult for them to do things, and but I always felt that living in the community, that we ought to pay our civic rent, and that the way we would do that would be involved with the community. The hospital, being a not-for-profit community organization, really was owned by the community, and so we always tried to do what we thought the community would want us to do. I used to tell the board members that we had 15 board members at the time. I was not on the board initially, but that if we had a community of 150,000 people and we had 15 board members, that each board member and every decision that they made, that they ought to realize that they were making the decision on the behalf of 10,000 people. And part of that 10,000 people, some of them would have jobs, some of them have very good jobs, some of them would not have jobs, some of them would have nice homes, some wouldn't have any homes, so that all of our decisions were based upon the fact that we represented the entire community.